wrong if it is done in the right way. For example, people come and they say that, I don't want to do Botox. I don't want to do filler. First is to understand that both are not the same. Botox is a protein which acts on the muscle, which helps in relaxing the muscle and thus prevents them from over-creasing. So it looks after lines of expression. There is hyaluronic acid primarily, and that is put in controlled amounts to fill whatever gaps or to contour your face. So both of them are different, both of them are not the same, and both of them are safe and really good if it is done in the right way. Gen Next or young generation is pretty open to learning. They also are not judgmental. I mean, they understand that if the skin needs to be healed, we need to give you medications, as opposed to the people from the past who actually believe that if you put something on your skin, just a cream is enough. Instagram has made medicine names almost seem like normal.
Yeah.
Like everybody doesn't need to use niacinamide as a routine. People don't need to use salicylic acid as a routine. People don't need to use glycolic acid without the reason.
Falguni, well, an absolute pleasure to have you.
Likewise, and thank you for having me on this podcast.
So, Dr. Falguni, let's start with your journey. What inspired you? I'm sure at the position that you are, it must have not been easy.
I think, like when we are raised, I think there is nothing like you're raised to be a doctor. You're not raised to be a dermatologist, cardiologist, right? So the first thing was, yes, I want to be a doctor. And since I don't come from a medical background, so I was not following a path which was going to me. So yes, I wanted to be a doctor right from the beginning. So I've said in the podcast earlier as well that studying comes rather easy to me, and that's the only thing which comes easy. Yeah, so I was a good student, and so the journey towards MBBS was pretty smooth. After that was when dermatology, when I got into dermatology, was not such a glorified or big field. Yes, it was just that we happened to be in the right place at the right time. I got into it by chance. This was not what I wanted to be, but I'm so glad I got into this big trend. Here I am after 23 years of practice.
Skincare, you're absolutely right. A few years back, probably a decade back, skincare was not so much, it was not so glorified.
I think for the longest time, skin as the largest organ of the body was ignored. People did not really take into account that skin has its own nerve supply, blood supply, just like the heart, just like your lungs, just like your liver. And so is it with skin. But skin was forever treated just as a beauty organ, correct? You go and your monthly facials and you glow on the day of the wedding or the party, and that's about it. But yes, to keep the skin healthy is as important as you need to keep your body healthy. So I think we as human beings have evolved, and so has skin.
What are some of the biggest challenges that you face in your practice today, and how do you tackle it?
Let me begin by saying what are the challenges I faced when we started practice.
Okay.
So when we started dermatology, when I started my practice, there was nothing like aesthetic or cosmetic dermatology as part of our curriculum. But we realized how just physiologically looking after the skin is so important as skincare in general, because poor skin, it just has to cover, it has to protect, and a very big thing, it has to look nice as well, because it's the external organ. So that's where we started getting or incorporating aesthetic medicine by ourselves into our journey. We used to find out what are the courses online, we used to gather money for them and then go and do those courses in various countries, because India was not really having any fellowship or any classroom course about aesthetics. This was something that we struggled to find out on our own. So that was a challenge when we started off. But yes, it was also, every challenge is also an opportunity, because it was not there. We were also the first movers. That aside, today I have two big enemies in my practice. One is Google and the other one is Instagram. I'm very sorry to say this, because Google has made so many non-doctors as doctors in their mind, and Instagram has set benchmarks which are unreal. So one is people come half-educated, wanting to look which doesn't exist. So there's two extremes. So yes, what we see now is we have to first unlearn people. Then comes what you want to look like. Instagram is full of filters and full of makeup. And when they say that we want to look a certain way, and I was like, no one can look like this. I had to actually educate myself over technology, because I had to learn what filters are there on Instagram. There are these challenges, yes, but if I can use them to my advantage, I can do better. So, for example, I now use Instagram to my advantage, by putting out videos out there which will tell them what is right and wrong. Like, let me give you an example. I have young girls who come into my clinic, and if I tell them, what is your skincare routine? Just let me know. So they will say, I use niacinamide. They use these drug names rather than saying that I just use a face wash. We are now making the skin normal because of overusage of products, and then starting with the main complaints. And plus, it is important for us to tell them, when people come saying, I want the Korean skin. Korean. How can you have Korean skin if you're not a Korean? The other thing that I would like to bring to the table is that nothing is wrong if it is done in the right way. For example, people come and they say that I don't want to do Botox. I don't want to do filler. First is to understand that both are not the same. Botox is a protein which acts on the muscle, which helps in relaxing the muscle and thus prevents them from over-creasing. So it looks after lines of expression. Filler is hyaluronic acid primarily, and that is put in controlled amounts to fill whatever gaps or to contour your face. So both of them are different, both of them are not the same, and both of them are safe and really good if it is done in the right way. Most of the people that you see on screen have had some help or the other, which has to be, right? I mean, if today I want to progress in my field, I am going to do a couple of fellowships extra. It is the need of my field. Similarly, if somebody has to look a certain way on camera, they will need a little help to be looking proportionate or to look a certain way. Because today's world is very evil. If somebody is not looking good on screen, they will say, oh, that one is ugly. If someone is looking nice, they will say, oh, she's Botox. I mean, what do you guys really want? So each is own. Everybody's free to do it, and everybody should decide for themselves whether they need to do it. From our end, I will say that if you're doing it with a qualified injector and with someone who has the right knowledge of anatomy and knows beauty as well as science and can amalgamate both of them, you will have a fabulous result. Secondly, most of the people say if they look a certain way on camera, it is never just olive oil. I mean, it's a lot more than that. I wish celebrities would come out there and support it and say that, yes, I've done that, and make it a little bit more normal so people find it normal to have a conversation about it so they don't end up having any myths. Whether to do it or not, each its own. The other thing that I've seen is there is an entire new skin disease which has developed right now, which is called the sensitive skin syndrome, which call it SSS, which means a skin has become sensitive because of overusage of products. Secondly, is the wrong usage of products. I think we have to follow the concept that less is more in skincare. Secondly, give your skin time to show the changes because of the products out there and people marketing them. People use a product for 15 days, this is not working, we go to the next. I think this is precisely the reason why I even started my own range of products. Where I formulate my own products, we have a pharmacist down south.
What is the difference between these over-the-counter products that we get? And now that we are talking about your brand, Radiance, it is the brand which is formulated by an expert like you. What do you think is the difference between these products? The products which are formulated by experts and the products which are available over the counter and absolutely anybody has an access to.
I'm not saying over the counter products are wrong. They have their own brand. Like people to use a moisturizer from one of the well-known brands. But what I think is what I have done with my products is I know what to not do. Because I've seen so much going wrong that what percentages to not use, what ingredients to not mix. That is very important. You cannot mix two ingredients which are going to bring down the efficacy of one. So that's what I wanted to put across on the table. But use less, use the right thing, just maintain your skin for the larger period.
Falguni, how do you stay motivated and passionate about your work every single day?
First, I want to say that I love my job. The second is I am passionate about it is because probably when you get into the depth of science, you realize that you know so little. So when you get into the depth of science, it motivates you to read and to stay abreast with what's happening in today's world of dermatology. Secondly, those few messages that I get from my patients who will write to me or send me a WhatsApp and say that, thank you for adding the confidence to my life. Thank you for making me a better version of myself, the patience and their appreciation. And when you see somebody who has not been able to get married for a while, with who's an absolutely brilliant girl, but has scars on the face and finding the right match. And just by a little bit of help, when she started looking a better version of herself, she found the partner of her dreams. And I would say, yeah, these are small successes which go a long way in, because beyond the point, it is also about the mental satisfaction I get from the gym, which keeps me at it. Absolutely.
This ever evolving fields that you're in, dermatology, how do you keep yourself current? How do you keep yourself updated?
It's extremely important to keep yourself updated so that you stay relevant. That's one. The best way to keep yourself updated is to keep in touch with all your colleagues and peers all over the world, to attend and learn and take workshops and even sometimes teach. Because when you teach, it could be a basic topic which I know so well. But when you teach, you learn the basics of it all over again. You have to stop feeling that you know it all. Once you spend certain years in the field, you start feeling that you know it all. But that's when you have to take a step behind and say that no, there's so much one can't know it all.
See the role of dermatologist in this ever evolving industry of digital tools.
There are a lot of digital tools that we can now include in our practices because technology is helping all fields and skill is not away from it. So getting the technologies into your office, investing in those technologies, there are digital tools which sometimes help you assess the early levels, the moisture levels in the skin, the pigment placement. To be heated all the time, no. There are times when just a clinical diagnosis is important and you see the patient you don't. Or is a digital diagnosis the only thing? No. We will have to combine the two. So when you don't touch with the patient is important, and then when you enhance it with a digital tool, you're only going to make it better. So I'm very open to technology. I love getting the newer machines into my office because that keeps me motivated as well. Yes, I'm a huge sucker for getting the digital and technology in your office and adapting it to it. So what do you think is going to be the future of skincare? No. I think the future of skincare is going to be in biostimulators and regenerative medicine. We are slowly going to go away from trying to look young or to move towards trying to look youthful. Once you do that, I think this whole drama that we have in our head of trying to look young will. So anti-aging is going to have a new definition. Anti-aging will be prevention of age. Another thing which I have noticed is that skincare is now not just a woman's prerogative. I have seen that men are as much concerned about the way they appear because gone are those days that men were known because of the status and wealth and women were known because of their looks. I think women are now into status, wealth and looks. Men are feeling left behind. So I think along with the status and the wealth, they are getting into looks as well. So let me change the word looks. It's sounding very superficial. Let me make it as appearances. So if the ratio was 80% women and 20% men in the past, today I can almost say that 35% of our patients are men and 65% are women. So men are catching up. The women are still leading the pack. I think women are achieving way more than men, or rather, let me say that men are wanting to look as good as women. So it's both ways. We are in a neutral and fluid world, and it is showing in our practices. And I'm so proud that today a woman doesn't have to depend on anything for a success, which means she doesn't have to depend on a male partner, or she doesn't have to depend on a father or a parent trying to make her successful. But I think they are on their own path. And a lot of credence is given to the way they appear. Because like they say that you can win the world in a skirt, you don't even need to wear pants. So I think we are getting there. And it's a lovely time to be a woman. I think so.
Thanks.
Yeah. So a friend of mine had once asked me that can women have it all? At that time, I was wondering, can they have it all? Because in this society, somewhere women have been the bearers of the moral responsibility, or I think they bear the morals of the society. So they have to behave a certain way, dress in a certain way, and also follow a path in a certain way. But today, I want to tell women out there that go ahead and you can have it all. You can be successful, you can be famous, you can be a good mother, you can be a great wife, and you can look good as well. So I think it's a right time and a great time to be a woman in the society because you're going to be successful, famous, and good looking at the same time. So go and grab it. This is your time.